Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I'm your host, Daniel Marino. As we talk about different population health topics or value-based care topics, most of the time we talk about those around certain conditions and how we need to manage those conditions. And in particular, we often focus on the rising risk population or the high risk population. But there is a large segment of our population that either may not have necessarily a chronic condition or have a condition which oftentimes needs a lot of care but doesn't necessarily have the reimbursement. And I'm particularly talking about patients who have dementia or Alzheimer's. And it really does take a toll on not only the patients who have dementia or Alzheimer's, but it takes a tremendous toll on the caregivers. And the thing that we struggle with as an industry is the support around patients with dementia and with Alzheimer's, and particularly the financial support there is really not reimbursable by Medicare and even by Medicare Advantage. And yet we see the numbers increasing. Right now, there's approximately about 6.7 million Americans who have some form of Alzheimer's or dementia. And that number is only expected to grow as our population ages. Well, CMS has recognized this and over the last year has put forth a new innovation project. I'm really excited to talk about this today. It's called the GUIDE model. It stands for Guiding an Improved Dementia Experience. There's been a number of organizations through this innovation concept offered by CMS that has been awarded as a recipient to manage it. One of our guests today is from JVS Health. JVS has been awarded as a recipient of the GUIDE model. I'm excited today to invite Vanessa Guzman. Vanessa's been on the program before. She is an industry leader in population health and is CEO of SmartRise Health. Also joined by our partner, Seth Hyman, who's co-founder of JVS Health. And again, Seth has had a lot of experience in working with different ACOs around the country. Vanessa, Seth, welcome to the program.
Thank you
Thanks
so much for having us.
Thanks for having us, Dan. It's good to be here.
Well, I have to tell you, I think everybody, either directly in your family or we all know somebody who has some form of dementia. Whether it's light dementia or it's advanced dementia, it takes a significant toll on the families. And when we started to first talk about this, I really did get excited just because I feel like this is such a need that really we need to embrace as a healthcare industry and as healthcare providers. Maybe, Vanessa, we could turn to you. Can you give just a little bit of background on the GUIDE program and sort of the goals?
Yeah, the model, and thanks again, Dan, for having us, because it's such an important discussion, because one of the biggest challenges in dementia care has been the lack of consistent care and consistent support, especially for caregivers. So what this model does is it convenes and integrates 3 key components that, from my perspective, are key success factors for any dementia program. One is standardized assessment and care planning and how you deliver those services that are appropriate for dementia patients and their families. It does include also interdisciplinary care that integrates not only services that are delivered at home, but wraparound services for both the caregiver and the patient. And it also includes a training component to support the caregiver. Those are core factors that I feel will stand up any program for any population, but especially for dementia. From a services delivery perspective, it delivers two main things. There's care coordination, and as you well know, Dan, working with ACOs across the country, one of the biggest challenges that we always bump into is helping patients navigate the complexities of any health system. But when a relative or a loved one or family member, friend is diagnosed with dementia, there is confusion across not only to access the care, but to really understand what exactly do I need to care for my loved one, right? So the care coordination is a key component. Then the other component is the actual caregiver services that are provided, which include assessment and planning, community resources, and then access to support line 24/7 within what's appropriate for the dementia patient.
Well, and you're absolutely right, Vanessa. I think one of the key things that I really appreciate about the program is it provides a direction to the caregivers, right? Because many of the caregivers, you're right, they don't know where to go. And unless the patient has some type of a health condition, and many of them don't. Many of the patients who have dementia or Alzheimer's may be perfectly healthy, right? Unless they have a condition, where do they go for support, right? And there's just nothing out there.
There's nothing out there.
So Seth, let me turn to you. Talk a little bit about the specifics of the caregiver support, right? Because I'm assuming the program has quite a bit of resources that are available to it. What are some of those resources that would be available to the caregivers?
Yeah, exactly. You're exactly right. And I think what differentiates this program and what we're so excited about is the care navigators. That's really the engine or the driving force of this program, is that every family, every patient is going to have a one-on-one relationship with the care navigator. So it's different than some other chronic care management programs where you might have a nurse that you talk to once a month, and then every month it's a different nurse. This is really a program tailored to the specific needs of the family and the care recipient. So those care navigators will be able to, as Vanessa kind of touched on, do everything from coordinating transportation, coordinating meals, coordinating care between the specialties, right? Sometimes these folks will have multiple different providers and it becomes overwhelming just keeping all the visits in order. So having that one-on-one relationship is really going to be something that's very beneficial for these families. So we're very excited about that. And of course, we're going to utilize our technology to do it in a way that makes it convenient for these families.
So, let me share a quick story with you. I have a good friend of mine, and his parents were in their mid to upper 70s, and his father came down with dementia, and his mother, bless her soul, did a fantastic job of really taking care of his father, but it created such a strain on his mother. And as much as the family tried to intervene and provide the level of support, it was hard, right? Because she was taking care of her husband 24/7. I know that there's included in the program, I've read that there's respite services, there's other care services that would be provided. Seth, what are some of the things that would be included as part of the guide model?
Yeah. So one of the aspects of this program that we're most excited about and everyone is most excited about is the respite care. So this is the first time that CMS is paying for any sort of respite care. And what that means is home care, adult day centers, or even a stay in a facility. So this is the first time they've done it, and there's no cost to the patients. So any Medicare beneficiary is eligible as long as they have traditional Medicare, they're eligible for the program. There's no cost, no cost sharing, no co-pays, no deductibles, nothing like that. So being able to provide that sort of relief, just, you were mentioning your friend, we all have someone. My grandfather
Sure.
was taking care of, my grandmother with dementia. And it's just, little things like you don't have time to go get a haircut, right? You don't have time to do anything. So being able to provide these free home health services, even for a couple hours a week, is going to be such a game changer for these folks. And we are just so excited about that. So we will work again with the family to come up with an offering that works for them. If they want some portion to be home health, some portion to be stay in a 10-day facility, stay in a facility for 10 days where, they're going on vacation or something like that, we'll work with them to manage those resources and provide the resources that work best for the family. So the respite care, I can't stress enough, how excited we are about that. And I think once people hear about it, their eyes light up because it's like, this is something they've been needing.
Yeah, absolutely. Absolutely. And it just, it just provides that additional support. And as you mentioned, it does provide some needed support to the caregivers. But what I like particularly about the program is that, there's really two key aspects that drive the care plan for our patients with dementia and Alzheimer's. And it's really that care coordination between the providers, and it's the caregiver services. I think those are absolutely key. And as many healthcare providers are working through their care management, this, I could see being a natural progression of how we want to manage care for patients who do have dementia and Alzheimer's. How do patients get enrolled, right? This is a free service, but, at the end of the day, Medicare is paying for this, right? So at some point, we need to be able to connect the dots around what the funds flow and economic model look like. How do patients get enrolled into the program?
Yeah, so there are few pathways where patients can be enrolled. The first one is, and regardless of pathway chosen, is a diagnosis of dementia based on a care assessment that is designed to help identify the severity according to an approved clinician that will determine the level of effort or level of services provided to each patient. With that diagnoses, either the patient, caregiver, or provider can refer the patient to the program, to a participant like JVS Health, and then we'll kick off a series of next steps and enrollment and engagement, including providing with the caregiver or the patient or the provider with an overview of how the program works. Of course, CMS has dedicated much resources and providing participants like JVS Health with data to also help us identify the opportunities to engage families in care that potentially don't know about the program. I think one of the challenges that we will face inevitably is that most families that have a loved one or is caring for someone with dementia is that they don't even know where to start. So we really want to be proactive with working with providers this entire year going into July, which is when we kick off the program officially, to raise awareness that this actually exists so that they can carry on effective conversations with their providers so that this program is integrated into their primary care, into their specialty care. This should not be like a standalone thing. In order for it to be as effective as it can be, it has to work closely with the providers as well. So a number of ways to get referred, but we all need to have a proactive role in making sure we raise awareness in order for families to know that we even exist.
Take
right?
advantage of it and know that this is out there. If you're just tuning in, I'm Daniel Marino, and you're listening to Value-Based Care Insights. I'm here today talking with Vanessa Guzman and Seth Hyman, and we're discussing the newly launched guide model that's being offered through CMS. Seth, as Vanessa was talking about the program, I guess one thing that came to mind is How does that integrate with the current CMS ACOs that are out there? I would imagine some of these Medicare patients are part of ACOs or part of Medicare Advantage. Is this a separate ACO for dementia patients, or how does it integrate with the current ACO structure?
That's a fantastic question, and I'm glad you asked that, because CMS has designed this to be a parallel program with other ACOs or other MSSP programs, like ACO Reach, for example. So they actually want patients to participate in both. So just because a patient is in an ACO, is participating in an ACO through their provider or a health organization, they could still be enrolled in a guide program. And in fact, CMS just announced, which is great news, that the respite payments will not factor in to the benchmarks for those
Oh,
patients.
that's
So that,
fantastic. That's great.
yeah,
That's really good
yeah,
news.
it's so they're really um, encouraging folks to get signed up for the guide model. And for other we're actually in discussions with other ACOs to kind of work with them and to get their dementia population to come join up with the guide, because they see the value in this. They see, we could help reduce the total cost of care for these folks by devoting minimal
Yeah.
resources. And a lot of time, what happens is a lot of times patients with dementia or Alzheimer's end up in the emergency room frequently, just because they're having an episode and the family doesn't know what to do, so they take them to the emergency room. And as you know, those are some of the highest drivers of cost. So for example, if we have this 24-hour hotline that they could just call and sort of alleviate some of the stress that they're feeling, we could help to maybe reduce some of those hospitalizations and ultimately delay, admission to a skilled nursing facility as well. That's one of the main goals of the program. So it's really designed to work with the MSSP program and other value-based care programs, and they want us to have that integration.
Well, I
And
would think, oh, go ahead, Vanessa. I'm sorry.
no, I just wanted to make a note that it's the way that it's designed, it requires participants to infuse or integrate a health equity plan, which is huge, right? Because when we were thinking about innovation models like AHEAD or ACO Reach, that's very much baked in there as well. Not to mention that in value-based care, several states are requiring health equity accreditation. So my point is that there's infrastructure that ACOs or those in the journey of value-based care can leverage and help advance via, participating or enrolling patients, helping us enroll patients in this model. My dad has dementia. He was diagnosed 11 years ago. I am Latina all the way. My parents are both Dominican. They only speak Spanish. My mom has been caring for my dad for all 11 years, putting aside her own priorities, as you mentioned in your story, Dan. And we've seen a decline in her own health. She misses appointments all the time because there's something going on with him, and that takes priority in her world. And the fact that we can tailor the services based on the caregiver needs from a cultural appropriateness perspective, that fills my heart, because this is not just going to work magically via, oh, we have a program and now we're going to provide you with resources. It has to carry the right naming, shared language, appropriate language, right? For non-English speakers, for instance, and the trust. We have to be able to
Right.
earn the trust of our communities for us to engage their their loved one or the person they're caring for. Otherwise, we won't be successful. So I just wanted to point out the equity piece of this is integral to the success of the program.
Absolutely. And to your point, it certainly does have to be multifaceted, where it really aligns with what the care needs are of the community, the care needs are of, I would say of this population. Because, again, when you think about it, the demographics associated with dementia, you hear patients who, it's tough to say, but there's patients even in their late 50s, early 60s who have dementia versus those that are much older in life who have dementia. So I think it does have to be multifaceted. And I think this could be, as I see it, a tremendous opportunity for ACOs who do have a large attributed population
Absolutely.
within their ACO to be an extension of managing patients. I think it has a real opportunity associated with it.
Absolutely.
So let's talk a little bit about some of the funds flow, because I think this becomes important. This is a free service, right? But primary care, or somewhere the physician has to be able to either refer or recommend, or if a patient, caregiver does, self-refer. How do the economics work? I mean, is JVS Health getting support from this, or do primary care still can bill the same way? At a high level, maybe Seth, you could address this. How does the funds flow work?
Yeah, absolutely. So CMS has designed new G codes specifically for the guide model that
Oh,
only
great.
guide participants are able to bill for.
Okay.
So, and that's on the respite side, and also for the monthly per beneficiary per month payments as well. In terms of how this won't affect the primary care providers though at all. So they continue to see that, we want to stress this. We can't stress this enough. Continue to see the patients the way they normally would. Doesn't affect any billing or any care that they're providing to their patients, whether that be primary care, neurology, geriatricians, whomever. They continue to just see the patients the way they normally would, but
Oh,
they could
that's an
just
important point. So they
yeah,
continue to see the patient, they continue to treat the patients for whatever condition that they have, and they continue to bill, as they normally have. Fee for service codes still work the
Right.
same. So, they're not limited based on their reimbursement based on patients enrolled in the program.
exactly. We do not want anyone to think that we're trying to take over the
Right.
care of these patients. We are not practicing medicine. We are strictly providing support for these families and these patients, and just providing additional resources. And as we know, our other partner, Dr. Hyman, he's been a practicing primary care physician for almost 40 years now. And a lot of times he feels overwhelmed when he gets a patient with a new diagnosis of dementia. It breaks his heart because he does not know what to tell the families. He doesn't
Exactly.
have the resources to kind of help them. So I think we have a real opportunity to help and be a great partner to primary care physicians, all through, or any primary care provider throughout the country, and help them manage these patients and give them resources that they just wouldn't have access to otherwise.
Yeah, well, it makes sense then. So it sounds like as patients are referred to you all and get enrolled into the program, then you're providing some of that coordination, that caregiver services, billing Medicare separately, and then you get reimbursed. So you're almost an extended provider of the care that's being provided then through their normal physician community, if you will. Again, I mean, that sounds great because there's no conflict of interest there.
Correct.
Yeah,
Correct.
exactly. That's a great way to put it.
And it doesn't weigh on their total cost of care if they are an ACO participant, as Seth mentioned earlier, which means there shouldn't be any hesitation, right, in using our services, because this doesn't go to that
Yeah.
bottom line, for lack of a better term.
Well, I'm sure this is new to a lot of folks, and I'm sure after our listeners kind of dive into it, they're going to get excited, particularly our provider community. Again, I think from an emotional standpoint, and certain from a practical standpoint, this makes a lot of sense to our caregivers and to our provider community. How can folks learn more about this? Anywhere that you would direct them, or maybe they can reach out to you all? Any thoughts?
Yeah, there's several ways. We have informational content on our website, www.jvshealth.com. Just click on the guide model tab on the top banner. You can also email us at info@jvshealth.com. You have the ability to submit a form or send us an email with any questions. But what we encourage you to do the most is talk to your provider also about it, because they might be able to also answer specific questions on what you could do now. Our program does kick off in July of 2025. So in the meantime, we will work with providers across your community to make sure that there is awareness and that we build partnerships so that when we get to the July timeframe, we are ready to enroll you and your family member.
Wow. Well, that's great. Well, I wish you all a lot of luck in this program. And again, I think this is something that is near and dear to my heart. And I'd love to have you all back maybe in another 6 or 8 months as you started to kind of go through this a little bit and just to hear how things are going. I know you're not kicking off until July of 2025, but wish you a lot of luck and a lot of success. I think it's going to be great.
Thank you. We appreciate
Thank
you
you.
having us.
Yeah, thanks, and really appreciate the opportunity to talk about this.
My pleasure, my pleasure. And I want to thank all of our listeners for tuning in. If you want to learn more about this topic and others, please visit luminahp.com. Until the next Insight, I am Daniel Marino, bringing you 30 minutes of value to your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the programs page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.